Have you ever heard someone say, "I have a slipped disc"? But what does that actually mean? Can a disc really slip? And why does it sometimes cause pain that travels all the way down your leg? Imagine you are picking up a heavy grocery bag. You bend forward, you lift it. Suddenly, you feel a sharp pain in your lower back. At first, you think it is just a muscle strain. But the next morning, the pain travels into your buttock, down your leg, and sometimes even into your foot. Walking becomes painful. Sitting becomes uncomfortable. Even coughing or sneezing makes the pain worse. So, what happened inside your spine? In this video, you will learn what a herniated disc really is, why it causes pain, how doctors diagnose it, and the best treatment options. Let's begin. Whether you're a patient, a medical student, a physiotherapy student, or simply curious about the human body, you're in the right place. Welcome to MediLearn Hub, where we make medicine simple. If you enjoy learning with us, consider subscribing. Now, let's begin. Before we understand the problem, we first need to understand how a healthy spine works. Your spine is made of many bones called vertebrae. Between every two vertebrae is a soft cushion called an intervertebral disc. This disc works like a shock absorber. Every time you walk, jump, run, or lift something heavy, these discs absorb pressure and protect your spine. Each disc has two important parts. The outside is a tough ring called the annulus fibrosus. Inside is a soft, jelly-like center called the nucleus pulposus. When both parts are healthy, they allow your spine to move smoothly while protecting the nerves nearby. So far, everything is working perfectly. But what happens when the outer ring becomes weak? Think about a jelly-filled donut. When you squeeze it too hard, the jelly pushes through a weak spot. A herniated disc works in almost the same way. The soft inner material pushes through a tear in the outer layer of the disc. This is called a herniated disc. Many people call it a slipped disc, but that name is actually incorrect. The disc does not slip out of place. Instead, the soft center bulges through the damaged outer ring. This can happen because of aging, repeated bending, improper lifting, or sometimes after a sudden injury. But here's something many people do not know. Not every herniated disc causes pain. So why do some people have severe pain while others have no symptoms at all? The answer is the nerve. Right behind every disc is a spinal nerve. These nerves carry signals between your brain and your legs. When the herniated disc presses on a nerve, the nerve becomes irritated. Sometimes the disc also causes inflammation around the nerve. The nerve sends pain signals to the brain. This is why the pain often spreads beyond the lower back. The problem is not only the disc. The irritated nerve is the real reason for many of the symptoms. Here is one of the most interesting parts. The pain is not traveling because the disc moves down your leg. The disc stays in your back. The nerve carries the pain signal. If the sciatic nerve is affected, the pain follows the path of that nerve. It starts in the lower back. Then it moves into the buttock. It continues down the back of the thigh. Sometimes it reaches the calf and even the foot. This is called sciatica. Understanding this pathway helps explain why the pain is felt far away from the actual injury. The symptoms depend on which nerve is affected. The most common symptom is lower back pain. Many people also feel pain shooting down one leg. Some people experience numbness or tingling. Others notice weakness in the leg or foot. You may also find that your pain becomes worse when sitting for a long time. Coughing or sneezing can also increase the pain. That happens because these activities temporarily increase pressure inside the disc. The increased pressure places more stress on the irritated nerve. So, how do doctors diagnose a herniated disc? The first step is always listening to the patient's story. When did the pain begin? Where does the pain travel? What makes it worse? After that comes the physical examination. Doctors and physiotherapists check muscle strength, sensation, reflexes, and special clinical tests. If more information is needed, an MRI scan can clearly show the herniated disc. However, here is an important clinical lesson. An MRI should never be interpreted alone. It should always match the patient's symptoms and physical examination. One of the biggest myths is that every herniated disc needs surgery. That is simply not true. The good news is that most people recover without surgery. Treatment usually begins with conservative management. This includes physiotherapy, staying active, pain-relieving medication when needed, and learning proper posture and lifting techniques. Recovery often takes several weeks to a few months. Surgery is usually considered only if conservative treatment fails, or if there is severe muscle weakness or loss of bladder or bowel control. These situations require urgent medical attention. Remember, the goal is not only to reduce pain, the goal is to help you return safely to your normal daily life. Before you leave, here is one important clinical pearl that every medical student, physiotherapy student, and patient should remember. A herniated disc on an MRI does not always mean it is causing the pain. Many healthy people have disc bulges without any symptoms. That is why experienced healthcare professionals do not treat the MRI. They treat the patient. Your symptoms, your examination, and your medical history are just as important as the scan itself. If you found this video helpful, please like, subscribe, and share it with someone who might benefit. Leave your questions or suggestions in the comments below. Thank you for watching MediLearn Hub. Stay healthy, keep learning, and I will see you in the next video.